So at this point, our moderator for this plenary panel discussion is Iana Shaheen, and I'm going to turn this program over to her, and we can get started. Iana?
Hello, everyone again. Thank you so much, Keith, for the warm introduction. My name is Iana Shaheen, and today we will be listening to the discussion on supply chain innovation by state VOADs through better coordination. First, please let me introduce the panel members. I am Iana. I will be moderating the panel again, and I'm an assistant professor at the University of Arkansas. I do research on humanitarian and disaster relief, and I have been involved in several projects on supply chain innovation and collaboration and coordination during disasters. Our first panel member is Mr. Greg Forrester. Greg is the president and CEO of National VOAD organization, and he has tremendous experience with working with volunteers, community development, and disaster response and recovery for over 30 years. Prior to joining and leading National VOAD, Greg served as a New York State Trooper, led the United Methodist Volunteers in Mission Program for the Northeast, and also was the executive for the United Methodist Committee in Relief, U.S. Disaster Response Program. He has led humanitarian teams for over 40 countries to most declared disasters since 2000. Greg, thank you so much for joining the panel, and we're so excited to have you and share your amazing experience. Our next panelist is Ms. Kathy Fulton. Kathy Fulton is an executive director of American Logistics Aid Network. She leads the organization that facilitates the donation of logistic services and equipment of dollars worth of Kathy served as the director of operations for almost 10 years, and then she was promoted in 2014 as an executive director. Kathy is very passionate about intersection of supply chain and emergency management, and she focuses on the critical role of the logistics and supply chain professionals that play in facilitating disaster relief. Kathy, thank you so much for joining us. The next panelist is Dr. Arash Azadegan, who is an associate professor at Rutgers Business School. He's also a director of Supply Chain Disruption Research Laboratory. Dr. Azadegan has over a decade of industrial experience with Fortune 100 companies, such as Quaker Oat, Carlson Purina, and Ford Motor. His research focuses on supply chain disruptions and recovery efforts to mitigate them. He has ongoing experience in research in humanitarian and disaster relief, and we are very keen for him to join us and to share his experience. The last panel member, but not the least, is Mr. Keith Adams, who everyone knows is an executive director of New Jersey VOAD. He served as also as the New Jersey VOAD and vice chair of the board of directors. The immediate chair of the New York Jersey VOAD. He also serves as a partner for relief and resilience with Episcopal Relief and Development. From 2012 through 2018, he's the Episcopal Church in New Jersey Superstorm Sandy Recovery Program. He's retired in 2012 from a long and successful career with the US government. Once again, thank you everyone for joining our panel, and I'm looking forward to an interesting and interactive discussion. Before we start, let me just make a small introduction. As you all know, humanitarian supply chain management is an integration of key processes from end beneficiaries to suppliers, providing aid products, services, and information that add value for victims and other stakeholders. As you all know, coordination and collaboration are integral parts of humanitarian supply chain, and the primary purpose of humanitarian supply chain is to satisfy the needs of those who are affected by disasters. Meanwhile, unfortunately, many humanitarian organizations are challenged with the lack of collaboration coordination practices that should enhance their performance. In line with NJVOAD goals and missions, in this panel discussion, we'll try to find some of the ways, innovative ways, to improve coordination and collaboration by state VOAD agencies. And with that introduction, let me move to the first discussion points. And first, let us start by looking at what are some of the best coordination and collaboration practices adopted by NJVOAD as well as the national VOAD. And I think that it will be the best to start with the New Jersey VOAD Executive Director. Would you be so kind to open the panel?
Well, thanks. I guess the pressure is on me right now. So we're going to start. So I know certainly supply chain management is something that is a challenge no matter what disaster that we have. So thinking back to the last really large disaster or regional disaster that we had here in New Jersey before this pandemic was Sandy. So we adopted a lot of changes, and a lot of that really was about building capacity and establishing relationships with folks throughout the supply chain. And again, the focus was on what we imagined our next disaster to be, which was certainly in New Jersey's case, something probably surrounding a hurricane. But this pandemic has been very different because it has really put the emphasis not so much on a regional kind of large coordinated response, as much as a lot of little localized responses. And I shouldn't say little because they've been major, but they've been very local. So especially as we went through our period of, that people call lockdown, but honestly, social distancing and really trying to minimize travel throughout the state and so on and so forth. That's where the local networks that we had been working on over the past 6 or 7 years, what we call community resilience, have really paid off. But we've also experienced a few weaknesses that I'm going to give, we're all going to have an opportunity to talk about a little bit, where because we're not dealing with large national response organizations that are used to interfacing with logistics, in many cases, we're working with very localized food pantries and so on and so forth. There's some work to be done there, right, in terms of managing folks' expectations, even speaking the same language. So I think that's been the greatest challenges. So I think, maybe Greg or Kathy could speak to, they have certainly been responding not only here in New Jersey to our needs, but nationally. So maybe they could talk a little bit about the national experience in this pandemic.
Thank you.
Sure. If you don't mind, I'll go.
I was about to ask.
Yeah, for us, and I appreciate it starts with New Jersey, and Keith really led us down to talking about it's that local community-based response and how do we get it to that local need that's expressed in a disaster. And so for us from the national VOAD side, it becomes a matter of, I don't know what a little community in New Jersey needs. My hope for is that Keith knows it through that process and through the connections that they have within the state VOADs themselves. Where we act within national VOAD is one of, let's see what resources we can make available, and before we accept any of the items at all, we then put the information down through the channels to our state VOADs to say, is this something that you need? And then it goes both ways. What do you need? And we can also then go ahead and search for a product or a resource to go ahead and meet that need. So for us, it really is a communications channel in the very beginning, especially, and I like differentiating it between a natural hazards disaster versus what's going on with the pandemic, which has added so many more levels onto things moving forward. In a large natural hazards disaster like a hurricane, we as in the national level and our national members are going to get inundated with the opportunity to pull in resources. And I think we have to apply the same logic as we are doing now with the pandemic, though, and saying we're not accepting any of these until we know where they're going to end up or where they're going to be distributed at and how that distribution channel is going to work. And so it still relies then on that supply chain piece of being able to say thank you for the donations that you're looking to make from whoever is offering it, but also then understanding that before that is accepted into any community, we need to make sure that the logistics are there. And so with that, I'll turn to Kathy, I think.
Yeah, so Keith and Greg have both teed up some really important points. And before I move any further, I want to say, supply chain really should start with a pull, should start with a request, right? And so sometimes when we're working in a crisis situation, those of us who are working with the communities are getting, like Greg said, inundated. We're getting resources pushed at us. And certainly that happens in every crisis. It is not the optimal supply chain kind of way of looking at things. And so, when we kind of start to talk about what are the best coordination and collaboration practices, I think really we should look at how do we design our relationships. Yeah, we're going to design our supply chains, but we need to also design our relationships such that those conversations can happen ahead of time. Yes, we're still going to get the push of resources that may not be needed, but anything that we can do ahead of time on the best coordination and collaboration, and not just coming when it's imminent, but talking about it throughout the year, so that we can say, okay, now it's time to flip that switch. Now we need your support, and not just during response, but recovery for this natural hazards crises as well.
Thank you, Kathy, Greg, and Keith for sharing your insights. And from what can be seen, I think that there is several points that we also always need to account for in this panel. Is that yes, there is some local community-related practices, and then there is practices at the national level, as well as Greg correctly mentioned, there is different types of disasters, and we are usually prone to dealing with the natural hazard disasters. And now with the pandemic and the COVID situation, some of our burst coordination and collaboration practices that are adopted need to be adjusted. And before I move to the next discussion point, I wanted to ask whether Arash has something to add regarding some of the coordination, collaboration practices that he has experienced while dealing with and collaborating with so many humanitarian organizations.
Sure. So I hope you guys can hear me. If not, make a sign. Okay, great. Thank you, Kathy. So a couple of things. I'll come from the academic side, even though I've been on the ground working with folks. But just to put the academic hat and complement what you guys have excellently mentioned, let's make sure we define and differentiate between coordination and collaboration, at least the way the literature is coming together. And I know verbiage shifts around in terms of their meaning. But whereas collaboration is working together, coordination is the ability to manage, orchestrate, or direct that collaboration. So if you will, coordination is someone more equal among others, kind of like Keith and VOAD in terms of managing or handling. So they're part of the group, but they're also aligning resources. So that's the key differentiation between the two. On the academic side, the only thing that I can say is we know a lot about collaboration. We know it's beneficial and it's very, very important. But ironically, we haven't really focused on how do we coordinate, right? How do we make sure this alignment happens? And the work that we're doing right now, and I can dive into it more if there's an interest in the audience, is that who gets to do this coordination and how is it being done correctly? Because obviously, folks in the humanitarian arena tend to be somewhat autonomous, right? They're volunteers, they're joining because they want to rather than being forced to. So the extent of coordination becomes important.
Thank you so much, Arash, for differentiating between coordination and collaboration. And it's kind of very naturally leads to our second discussion point, is how do better coordination and collaboration, now since we're differentiating between them, affect organizational performance and disaster response. So let's start with Arash this time so that he can give us again this academic umbrella perspective, and then we can get some practical information from Keith, Kathy, and Greg.
Sure. Thanks. So yeah, I appreciate it. You know, I got to go back to what Kathy said earlier about pre-planning and doing things prior to events. You know, we're doing several studies, and I got to tell you, this is really interesting. One of the quotations that we're getting from the collaborations that are occurring, particularly related to the hurricanes in Florida, and including Sandy here in New Jersey, is pre-positioning. And one of the guys said, you know, we know all about pre-positioning our stock, but we haven't really talked about pre-positioning our relationships. And I love that quote, because that's what it's all about, right? You pre-position your knowledge of other people and what their capabilities and efforts are. So that's, let's just call it pre-collaborative building of relationships. So that's number one. From an academic standpoint, and you know, research on the supply chain of humanitarian is really as its nascency. There isn't much going on. One of the things we're realizing is that there is a hierarchy, so to speak, in terms of how coordination is best handled. There are some projects that are more on a dyadic, dual, just a couple of folks, you know, small organizations, NGOs, local community groups are working together. That level of coordination and collaboration is very different from the cluster that some folks are familiar with. And then of course, what FEMA gets involved. And each of these coordinative activities is not only different, but takes a different style. And so I'll stop there just to kind of tease out what we already, we think we know, right? We don't know this for sure, but again, I'm gonna send it back to the experts to offer more insight into these.
Well, I'm afraid to chime in on that expert piece because that that denotes an expectation, and I'm all about managing expectations. But Arash, you're absolutely spot on in this, especially like that piece about pre-building and pre-positioning relationships, and relationships being a big part of this. So our normal kind of, first of all, we've been working in New Jersey for the last 5 to 6 years, maybe a little longer now. And we positioned ourselves not as the disaster folks, but that we're community developers with a focus on disaster. We're working on community resilience, trying to build those relationships right down to the bottom. But we also have to work on top level relationships. And what I find in this pandemic, just like every disaster, is that you actually, you know, are able to build on the relationships that you had from the previous disaster. So in this case, and I'll just talk about food, you know, typically in disaster, we have a mass care plan, our mass care partners, the food banks, American Red Cross, Salvation Army, and others, you know, put that all together. This is very different, again, because it's very localized and spread out. There's no region in New Jersey that is exempt from this pandemic. So one of the tests that was very hard to figure out is, where are we giving out food? And where are the gaps most, you know, prevalently? Are you know, urban areas being well covered? Is there plenty of food, you know, being distributed there? And we have a lot of great visibility and, you know, kind of reporting back and data on that. But we also have a lot of rural communities. And it was very hard for us to track that down. And we actually participated in a partnership program with the American Red Cross to use their ArcGIS system to actually map. And we came up with some 1,800 feeding points, pantries. And the beauty of having a co-ed network and an organizational network across the state is, I don't know all those pantries. I don't know all those feeding points, but somebody that's connected to our organization does. So that's an example of you know, trying to, especially now when we had to consolidate volunteers and shorten the supply chain to feed hungry people. But there were other components too. We established a great you know, relationship with the New Jersey Food Council, who I knew there was a food council. I'll be quite honest, I didn't really know what they did. found out that they're kind of the VOAD for supermarkets throughout New Jersey. And that was a piece in this particular pandemic of feeding people, just getting people who could purchase groceries, the ability to actually get them delivered to their homes. So that was another relationship, and it was very important. And we wish we'd had that even a little bit more pre-positioned, but we'll certainly know this going forward in other disasters. And then, of course, it's this idea of, Arash, you mentioned FEMA and state government response. But this way of being able, we can't control the government response, obviously, from the NGO sector. We can certainly advocate before, but it does create, where we need to coordinate our activities. Because again, we're going back to food. If the answer is that we're looking to create an effective supply chain to make sure that hungry people get fed, then we need to be able to work across the spectrum, the whole community, to use a FEMA term, to make sure that is done and that we're leveraging all our resources. So just some thoughts I had on that.
Thank you, Keith, for very interesting points, and you have touched so many aspects of coordination, collaboration, and how it affects performance in disasters. So I was wondering if Kathy has a similar perspective, or she has experienced something a little different with leading a more national network of the organization.
Yeah, thanks, Iana. So I think, all crises are local, always. And it is that, better coordination at the local levels that has gotten us through over the past 6 months. But I actually kind of want to talk about this from a business perspective, because all of us are so reliant on commercial supply chains in some form or another. And so I think the similar challenges that we've seen from our business partners trying to figure out their coordination and collaboration activities during this crisis are very similar. I think they hold a lot of lessons. So I'm going to touch on one, and again, it has to do with food, because, the restaurants, the food away from home industry has been really hit hard, whether it's because of social distancing protocols or just because of people's fear, less people are eating out. And in your region, nearly before pre-pandemic, it was probably 45% of calories were consumed away from home, so consumed at restaurants and areas like that. That's way down right now. But so I'm thinking about organizations who, the grocery side of things, and Keith mentioned this, people still needed to buy groceries, but there's this huge surge in demand now. So some of the coordination and collaboration activities we've seen were those food away from home supply chains, the warehouse workers who may have been working in a food service distribution center were tasked to go work for a grocery retail distribution center just to help them with the throughput and volume. And so it's the resource sharing and the mutual aid. If you think about it from an emergency management perspective, what would you call that? You would call it mutual aid. And those are the coordination and collaboration things that are not just filling a gap, but also they're increasing volume and velocity to help those supply chains. I think those principles are very similar on the nonprofit side, where we're seeing groups coming together, doing that handoff where, meals are being prepared and delivered, food boxes, between one organization and another. And, to Arash's point, someone, it's probably not a single someone, but that does require coordination to understand what that handoff is, so that it gets ultimately to the hand of the family or the individual that needs it.
Kathy, thank you so much for making a parallel to the commercial supply chain. Overall, I believe that we got a very interesting perspective from 3 different lenses. Arash talked about prepositioning and how his research ties together with the importance of prepositioning, of coordination and collaboration. Then Keith interestingly mentioned the importance of the community level for the humanitarian organization. And finally, Kathy very wisely paralleled the humanitarian supply chain, the commercial supply chain, and the importance of resource sharing. And that kind of logically leads us to the next question that asks of how exactly can we ensure that the disaster response goes from community level so that we can leverage the existing community resources. And if Greg, you don't mind, I would like to start with you and just providing us with the national perspective on the disaster response from community level.
Certainly, and thank you. Yeah, and this, again, leaning into the current pandemic, I'll use an example. So we all heard at the very beginning as things rolled up in March that there was going to be a supply chain issue when it came to personal protective equipment. And so how do we, and there was no immediate way that was going to be solved. That was going to be a long-term problem. And so with our resources within our national member organizations, so National VOAD has 78 national member organizations. We have an organization in every state and territory, and those members are very used to utilizing volunteers for cleanup work and others post-disaster. And so most of them within their warehousing structures or within their own personal supply chain, they had N95 masks and Tyvek suits, nitrile gloves, and other things that could be utilized, you know, within the pandemic arena that was needed for first responders. So on the community level, what we actually communicated across the nationwide network was, if you have that and are not currently see a need for it within your own operations, please pass that supply on to your local first responders, whether that's your police or fire or hospital systems, knowing that at some point in time, the logistics and supply chain would go ahead and catch up with it from a national perspective and be able to backfeed what was given up. So again, for us, I think what's unique about the NGO sector so many times, and I really like that pre-positioning relationships. I got to remember that, and I wrote that one down, so I like that, is those internal relationships that we have because our volunteers are community members. They do respond and are able to go ahead and filter the information from a community bias, that we're able to actually to affect the supplies and affect change within that pre-positioning and delivery of PPE within the sector. And it really affected many of the hospital systems and the first responders. So I'll lead that, and then you can drive it to our other panelists.
Thank you.
I want to, can I jump in? Because Greg, I was on another call this morning where the question was asked, you know, were people hoarding PPE? And, you know, I wish I had remembered this example from early on and be able to say, my answer was, well, nobody could get it. But I wish I had remembered this example because it's a great way of showing just, you know, perhaps a difference in mindset sometimes that the way that our business community versus our nonprofit community approaches things, you know, and the ability that I think naturally the ability to collaborate and say, of course, let me share my resources with you versus I have to have all of this for myself because. So thank you for bringing that up.
Thank you, Kathy, for this valid point. And I was thinking is from what you have mentioned, from what Greg has mentioned earlier, I was wondering whether the whole community level disaster response and the mutual collaboration has become harder during pandemic as compared to the natural disasters, or whether actually pandemic kind of made everything closer together and ensure the community level response. So if Keith would be so kind to share his insights from the NJVOAD perspective.
Sure. I think actually, if you go back before the paradigm, what we've seen over the last 4 or 5 years, most specifically since 2017, when we experienced several major storms across the Southeast and the Texas, all in a very quick period of time, and fires in California. So our paradigm before this is that we have a system that can handle maybe one, maybe two, maybe three major disasters, regional disasters around the United States at the same time. But it was this idea that most of our national organizations would respond to a community. Certainly that was the paradigm in Sandy. Not always well connected to the community. They would come with their own kind of idea how things have been done, as i.e. they were the experts, which I hate that word, but came in and said, this is the template, this is what your community needs to recover. And certainly in Sandy, what we experienced here in the New Jersey, New York region was tremendous pushback because of the number, well, first of all, our very keen sense of local control, our very vast number of NGOs that are involved in the community, and of course our cultural and racial and religious diversity here. So it became difficult, but what I've seen is a paradigm shift over those years, and that is that we're seeing national folks unable to kind of parachute in, as well as FEMA. So there is more reliance on the community. So one of the good parts about that is the state VOAD working with communities to discover their assets, to connect them together in a way. We say all the time that every day is a disaster for folks in New Jersey. And what we mean by that is somebody's hungry, somebody's suffering from poverty, unemployment, all the social ills that we see every day. And really, if you think about it, when we have a disaster, none of those things go away. That's the context the disaster comes. And all of those problems become exacerbated. They become greater. So again, it's trying to work the whole community to work together in a way to connect those local assets, to give the community agency over the recovery, which I think is very important. And when we have those strong relationships and networks in the community, then our relationship, say, to statewide partners, whether they be government, nonprofits, or corporate partners, and then, of course, to our partners in National VOAD, it becomes a way of constantly looking, what's the unmet need? So we're talking about the need now, and who has the resource to fill that need, and how can we best deliver that need? So it is changing the thinking, I think, in a very positive way. Early on, I got asked in this particular disaster, well, what do you have pre-positioned here? How many volunteers? How many this? How many that? Kind of like I was a general commanding an army, and I pushed back, and I said, that's not the way this one's going to work. This is community resilience. This is what we've been talking about for 5 years. This is what it looks like in real time, and that is that you have a lot of efforts that are happening very locally, and the conversation with them is that where are your gaps? How can we help? How can we take these very localized efforts that are very successful and tie them together into a system, both statewide and then ultimately nationally? So it is changing the way we're thinking and seeing things, and I think, honestly, for the better.
Well, that's very valid and interesting. And with this whole idea of how the situation is changing and how the circumstances changes the way we look at the disaster response and at collaboration and coordination, it kind of logically leads to the last discussion point for today, but I kind of would like to concentrate a little bit more on that one, is what are some of the innovative ways that can be adopted by humanitarian organizations within the current circumstances and for the future to ensure better supply chain coordination and disaster response. And if Arash is fine with that, I would like to start with him, and maybe he can give us another interesting perspective, something that can top the prepositioning part.
Okay, so I got to make sure I don't use the word expert, first of all.
Manage expectations.
No, but yeah. So this is obviously something that we're interested in finding out, trying to be ahead of practitioners. Academics usually are behind, right? Unfortunately, things happen like right now with COVID, and then people are looking into research about it. And so we want to be ahead of this and say, okay, what do we do innovatively to be ahead of things? And of course, collaboration and coordination is an area that could benefit from new and different ways of looking at it, right? So not only from pre-positioning, but pre-identifying paths of, let's say, hurricanes, where it's going to go, and literally pre-position fictitiously and model it where it the potential inventory of food resources, human resources can be beneficial. So that's the idea behind innovation. And just to kind of provide a little bit of background, innovation is a big word, but really it's all about doing things better. Incrementally, just a slight modification or improvement can become innovative ways. And innovation can be on processes, right? The way things we do, or the outcomes in terms of what the outcome is for let's say nutrition, food nutrition, or and also innovation, frankly speaking, on a broader sense, can also be in terms of a market, finding new markets and finding new donors, right, and reaching out to potential sources of income. It can become also very helpful. It's not like we don't, nonprofits are always swimming in additional funds. So that's kind of a background. Hopefully that sets the stage a little bit.
Yes, thank you so much for setting the stage and giving us the overall perspective of different types of innovation and what innovation is. Well, now I think it's a good time to move on to the actual innovative ways that maybe some of you encountered or adopted or planning to adopt in your activities. So if Kathy wants to start.
Yeah, sure. So I'm going to make another parallel between commercial and humanitarian supply chains. So commercial supply chains have literally crammed 5 years worth of innovation into the past 5 months. And that is everything from automation within warehouses because of concerns about staff. It's even things like the barriers in the grocery stores to prevent droplet spread, right down to how we pick up our groceries, right? Whether it is curbside delivery or delivery direct to our house. That level of innovation is being driven by this crisis, right? So this crisis has created opportunities for us to change our work processes, as Arash mentioned. I've seen similar types of innovative deliveries or innovative activities from our humanitarian nonprofit partners. And I don't want to step too much on anything that Greg or Keith will say, but I'll tee up one and then let them dive into it. Food banks are very heavily dependent, food pantries, on people often coming to them to make that selection. With COVID and the lack of ability for people to travel and concerns about that, everything about a food bank's and food pantry supply chain has been disrupted, from the number of volunteers that they can use to the ways in which people actually select the items that they want. So I've seen lots of creativity with, whether it's, partnership with the USDA program or other things, but building those food boxes, helping people craft the, personalized food kits, food boxes for delivery, and then utilizing just, huge numbers of volunteers to go and drive and deliver those boxes to families, rather than them coming to a centralized location, putting themselves and the staff at risk. So I think I would equate that, I said commercial to humanitarian. I would equate that to kind of a food at home delivery, just like if you're ordering Instacart or any other thing, except the supplier in this case isn't your local grocery store, it's your local food bank, food pantry. So those are some of the innovative ways. And I think, you know, what are the ways that these things that innovation can be adopted? You know, I don't think we have to always look to the private sector or to the business community, but we would be silly to not let them spend the R&D money to develop the processes and then let us, you know, copy them and make them better, you know, fit our needs. So.
Yeah,
yeah, go ahead, Keith. I'm sorry.
Yeah, I definitely agree with that, Kathy. One of the things, I mean, certainly one of our major food banks here in New Jersey had to have some help. They typically had 200 volunteers that would come in and make food boxes. And of course, they're experiencing a 60% surge here during the pandemic that they wouldn't normally see. But early on, we worked with them to place volunteers in a strategic way. So they sent their 200 normal volunteers home because they couldn't social distance, and they went on a 24/6 schedule. So they took their employees and spread them across that time. And then we actually supplemented 10 volunteers from our VOAD organizations for each one of those shifts. So just like commercial folks, and you were mentioning about, you know, how they shifted roles, certainly there were some internal shifts in the way that went about. And of course, you know, working with the Food Council, I want to echo, they talked about that in terms of online ordering, how they're 5 years ahead of schedule. And then the last piece I just want to talk about in that is that working on systems with suppliers, both as partnerships between, and the groceries are an interesting thing because we have the food bank, which I think is kind of that safety net behind all this. But most New Jerseyans get their food from grocery stores. So the Food Council has a big piece of this, and so the corporate partners do. And then certainly government with, you know, our SNAP programs and DSNAP and other things. And I'll just give you an example how the three came together to work on an innovation. And that is, we found out in New Jersey the EBT or EBT cards with food SNAP benefits could not be used online, which was a big problem. They had to be used in person. That's what the regulation said. And so it took us about 3 weeks working together between the grocery stores and the Food Council folks and also our State Department of Human Services to change the rules. So folks could actually order their groceries online and participate in a grocery delivery program. So that was a huge innovation, and that I don't think that any of us saw because we were all sitting in our silos or cylinders of excellence, as some people say. This particular pandemic brought us together and to be able to see some of those gaps and act on them.
Well, thank you so much, Keith, for sharing your experiences. And before I move to Greg to share his practices with National VOAD, I just wanted to quickly anchor back to Arash and his academic perspective and whether he has something to add on the mimicking of commercial innovations that Kathy has mentioned, or adopting some of the virtual shopping practices that Keith has talked about.
Yeah, well, thanks for that. And in fact, that's what I was going to mention a little bit earlier, and Keith echoed it quite well. First of all, you use the term mimicking, right? And there's nothing wrong with that. In fact, in some cultures, that's the biggest form of respect is when you copy somebody. For some reason, it seems like we are hesitant to do so. And so we call it benchmarking, whatever else. And so one of the ways to simply help with collaboration and coordination is to simply share these ideas among. Be it within the food banks through Feeding America, or be it within VOAD, not suggesting that it's not happening, but I think that's generally how it happens with many industries very quickly. That's why you have clusters, let's say in San Francisco, in the Bay Area for high tech, Boston for because simply the information carries through and gets shared quite rapidly, and so technology or innovation happens faster. So that's one point. My other point is something that hasn't been mentioned before, and I think it's important to recognize, and this is on the challenges of, let's say, the humanitarian or the VOADs of the world, or disaster relief, and that is when you look at it from a supply chain standpoint, in terms of power in the supply chain, it's reverse. In a for-profit, right, Kathy, you know what I'm talking about here. In a for-profit setting, it's the customer that goes to a supermarket that has the ultimate say. They have the power, and so they expect the plexiglass, right, to be set up right, and they expect all the employees to have to wear a mask, et cetera, and frankly, my wife doesn't even go to these grocery stores now that they don't have a little sanitizer to clean the shopping carts, right? And so unfortunately, or for whatever, naturally speaking, that's not the case for humanitarian relief and just focusing on food banks. And so by default, the innovation tends to be away from what the ultimate consumer wants and is forced by the upstream members. Now, I don't have an answer to this. As an academic, I get to ask the questions, right? Unfortunately, right? But that's something that we need to recognize, that oftentimes the innovations that we develop or are forced upon us in the humanitarian setting is basically for the benefit of folks that are not necessarily the ultimate beneficiaries, or supposed to be the beneficiaries, right? So the donors and those expectations become primary, and hopefully they're benevolent, right? But who knows? So I'll just stop there.
Thank you, Arash, so much for sharing and kind of distinguishing between different ways of how it can be innovated. And before we will open the discussion for the questions, I wanted for Greg to kind of have a closing remarks from your national level perspective of some of the innovative ways that you have seen, or whether you had any comments on any topic that has been raised by Kathy, Arash, or Keith.
No, thank you for that. And I think I can wrap a couple of these things into it. So it's not about New Jersey, it's actually food delivery within Pennsylvania. And it had to do with both supply chain of restaurant packaged goods. So here it was, the supply chain, is used to delivering to restaurants in very large containers. They have to be opened with special tools within those restaurants. Everything's packaged very differently. And now the supply chain no longer had restaurants to deliver to. But then we turned around and there was still a need for ready-made meals that could be delivered to families through a food delivery system. So in Pennsylvania, the funding, of course, came from FEMA to the state level. And in Pennsylvania, their Department of Health and Human Services contracted with one of our nonprofits called Operation Barbecue Relief. Operation Barbecue Relief is one of those feeding missions that we have within our system, and they're used to preparing large quantities of food. But rather than do that themselves in Pennsylvania, they went ahead and looked at existing restaurants, and they said, well, if we use the existing restaurant chains and their existing supply chains, we can teach them how to pre-package meals, freeze them, and then have them delivered through the delivery system that is through our volunteer network and other networks that were there. So that's what they did. They took, the innovation was, they knew that there was all this food out there that wasn't packaged correctly for the consumer, direct-to-consumer use, but was able to also reestablish restaurants, rehire staff, use existing cook stations, et cetera, and then just use a different way of packaging in this COVID environment to be able to enable that food delivery. So very innovative in that respect. Another one that I just encountered this week is using technology. And so we're always looking for, that better mousetrap of how do we make sure that those private sector partners who want to deliver product into the supply chain for delivery to humanitarian services. So we had one of them reached out to us this week and said, look at what we've done. We figured out how to go ahead and create an online matching platform for this product to go ahead and be delivered through. And they're like, but we've hit a snag in that now we're not getting as much pass through our technology platform. And
Greg, you put yourself on mute. There you go.
had already been done by 6 different agencies, very same technology, and so there was multiple competitions to their drive-through traffic. And so we talked about how you need that community-based resource to be able to drive traffic, even to technology, to make sure that the input into the platform and the output that is anticipated out of it is effective and is working in a local community-based setting. So those would be 2 that I would offer.
Thank you so much for offering their insight and the experience. It's definitely very interesting. And I know that we can talk for a long time and about everything, but at this point, I was wondering if anyone from the audience can have any questions about any of the points discussed. You can please feel free to address it to any specific panel member or just general to the audience. And I would like to thank Linda for helping me to administrative the questions.
Absolutely. If you have a question, you can either enter it in the chat box or you can go to the participants panel, and at the bottom there should be a raise your hand virtual button, and we'll take your questions. I know some people asked if the presentation would be available, so as long as our panelists are okay with it, we'll be posting it on our YouTube channel shortly after the presentation. So look for it within the next couple days. And you can find that link on our website at njvoad.org under the events tab. And I posted that link in the chat box as well. So you can sign up for our next webinar taking place on September 9th. So does anyone have any questions?
So Arash, apparently we were experts. We've answered everybody's question.
I guess so. I have a question for the just general audience, just in terms of a probing question. Iana and I are working on something related to this, and I'm curious to know your opinions. This is clearly related to COVID and pre and post COVID in terms of coming up with a new ideas, different ways of doing things. And, you know, there's 2 ways of doing this, right? You can actually sit within your own organization and come up with new ideas of how do I make my food bank better and more efficient, right? Or how do I make my volunteer group be able to respond better or whatever else. Or you can actually call up on the phone and talk to other folks, or get on, you know, Zoom participating events such as this, right? Now, the commonsensical knowledge would say, well, gee, I don't have access as much to other people. Therefore, in the COVID environment and where everybody's in their cocoon, I have to come up with ideas on my own. But I'm curious as to what you guys think, because we have our own observations coming out from a data set that's being collected, and I would love to share that with you. But before I, you know, bias your opinion, any thoughts? I mean, you have a 50-50 chance of being right here, so take the bait, if you will, and tell us what do you think? Which one is more prominent and perhaps more effective? Internally developed improvements or innovations, or externally collaborative innovations?
Well, I'm going to go with the external myself. I think that there's a tremendous, you know, sense from the hive, so to speak, and the larger you make that hive, the more ideas that you're going to get, and the more expertise and perhaps benefit from others' experience. And I just wanted to come off of that with our experience during this pandemic. So I'll just compare it to Sandy. In Sandy, we had 14 long-term recovery groups across the state. And there was several of us that were the cross-pollinators, if you will, if you want to use the bee analogy, that were present at every one of those 14 long-term recovery groups. But there were very few opportunities for those long-term recovery groups to actually be together, share information. Certainly New Jersey VOAD provided some of those platforms, but to contrast that with this particular pandemic and using Zoom, where we were having weekly calls with 100 different organizations participating from across the state, I saw a much bigger collaboration, exchange of ideas, even though they were all dealing with their own very localized context. I really saw where folks were able to collaborate better. So that was a great opportunity, I think, that we're seeing in this pandemic with the use of electronic communications. You know, we're sitting here and we can talk to people from throughout the country, and they can actually participate in our meetings. So I just think that that's the wave of the future.
So Arash, Keith picked the external one, and before I know you're eager to share the insight, I was wondering whether Greg or Kathy have any opinions about internally developed versus externally developed innovations.
And there's also some comments on the chat area, Iana. Don't forget.
I'll just say that what I experience with the business community is both. It's both and. You know, there are some areas where they would never consider collaborating with a peer organization, and literally in some instances, you know, New Jersey is heavily pharma driven, where they can't, you know, because of antitrust issues. But at the same time, I think that on the shared resources component, you know, where they can be creative, I'm thinking the McDonald's example where all of their procurement folks all work together, you know, although their sourcing happens collaboratively, I see both, right? So I think it just depends on what the end goal is. If your end goal is let's all work together, then that collaboration is needed. But the internal piece, especially when you are competing, and so we all have to think about what are we really focused on the 4 C's, or is there some other motive?
Thank you, Kathy, and Arash, please feel free to jump in. And also, unfortunately, because I'm sharing my screen, I can't really see the chat area. So Arash, if you can just, you know, kind of grab some of the questions and comments that come in, that would be great.
Yeah, sure. So thank you, Shalissa. Your last name is just as difficult as mine. I'll try it. Kutalakis, right? I hope I didn't butcher it. I apologize. She says, I like the internal receptivity and then the use of external perspectives. As you mentioned, after the internal collaboration, it's important to get the opinions of those doing the work in the field to ensure we covered all our bases. So this is interesting. This is complementary to what I was mentioning earlier. Shalissa has an internal perspective validating the outside, right? Whereas I think Keith is suggesting, well, gee, go outside and talk to folks and then see if you can implement it internally, right? It's just basically both complementary. It just depends on where you start, ergo the chicken and egg story. Sally talks about there will be concern about outside ideas that are helicopter, and I love this. Yes, this is excellent, right? Whereas outside resources are generally welcome. Honest two-way communication is really the most critical. Yes, so we call it NIH, not invented here. So I never thought I would I would be using this in a, you know, in a nonprofit setting. NIH is, you know, for, like Kathy was saying, in the pharmaceutical industry, we're never going to do what IBM did because we're Dell, right? But yeah, I guess this is unfortunately a disease that carries all over. So excellent points. I'm curious, Greg, any comments from your side?
Yeah, I think, you know, within and I think it's because the NGO sector side of things, where we don't have, when there's a lack of resources, whether it's money or things or even personnel, because so many of our agencies, you know, really rely on very little paid staff or otherwise. I think that idea of getting things from external perspectives and really that collaborative, coordinative piece is crucial to survivability, because you don't have the resources to do it on your own. So if you can find somebody that's already done it and it's successful, then you can tweak it, but you're going to grab what they've done and go ahead and move forward with it. And we do still, and I hate to say one of the C's that we don't talk about even in the nonprofit sector a lot of times is there is competition still within the nonprofit sector. And so we're finding our way, I think, in a greater way out of that in COVID, because who would ever thought 56 state and territories, simultaneous disasters, and so the resources that are needed to go ahead and respond to that nationwide, we have to rely on that external components coming in.
Greg, thank you so much for sharing this last closing remarks. Unfortunately, we kind of need to finish the panel as the time is coming to the end. I would first like to thank the panelists for finding the time and sharing their best practices on collaboration, coordination, and innovation. And of course, I would like to thank Keith, Linda, and NJVOAD for organizing this panel. And if you have any further questions or comments, I'm pretty sure that Keith and Linda would be kind to share any of our emails address if you just want to continue the conversation online. Thank you so much.
Thank you.
Thank you.